We're interrupting the merciless ribbing of Mike Chitty that's going on in the room to bring you the final group broadcast from a group that's working here, which is called GP Hop, and we're incredibly excited that they've got a PowerPoint presentation to share with us. So I'm going to point the camera around so that they can talk to you a little bit about GP Hop, and I'm going to try and get in GP Hop. And I'm going to try and get in a position where you can share the wonder that is PowerPoint with us.
Try and put it over on that table.
Is hop slang for cannabis, says someone online who shall remain. Let Grandad do it. I'm handing it to Mike.
Should
I point it? Somebody that can explain what's going on? You have to get quite close.
We see the presentation. I think the presentation is more important to see. We do have a live demo as well. Semi-completed, yeah. So we'll go to the slides quickly because I want to get onto the live demo. Okay. So the idea of the GP Hop application, how's that looking?
Looks good.
On there, is it's basically a website which enables patients to log on and move between GPs. So it allows them, if they're moving house or moving GPs for any other reason, to log on, have a look at a list of GPs, and to actually perform the GP move itself by intercepting some currently existing national program messages called GP to GP messages. Okay, so I'm going to go through quick the advantages for the patients, and our GP here, wherever he is going to talk about the advantages for GPs. Some of the hurdles and challenges that would still face getting this into a live, fully commercial application. Talk about the systems we've integrated with, because that's really the challenge. I'm afraid the GUI is a bit basic, but the challenge has been integrating behind the scenes. A quick walkthrough and summary of where we're up to today. We hope to finish by then today, if we have time. And then a quick demo. So I'm going to be really fast in order to get onto the demo, so forgive me if it's a little bit too fast. So the advantages for patients, this is really all about GP choice and patient choice and patient empowerment, which is a big part of the National Information Strategy at the moment. Patient can choose GP practice, you'll see that in a minute, based on, at the moment, just based on their postcode, we can list GPs, and then they can see information including things like practice location, whether the GP will communicate via emails and other kind of features of the GP practice, prescription ordering, average appointment wait time, a load of data that we were planning on getting in via the Quality Outcomes Framework, that's the right acronym, the QOF data, which we've got the data set here for, haven't quite done that yet today. But that's got loads of information about specialisms and how the practice is doing in relation to things like diabetes and other conditions. Whether or not the GP has got a specialist interest, and also any patient comments. The patient comments, a lot of this information is taken from the NHS Choices website, and of course the patient can initially automatically initiate the transfer, and you can also do things like, for example, track GPs who are refusing occupations. We've had a conversation today about GPs refusing health patients, for example, and so it really helps stop cherry picking of patients and that kind of thing. By keeping all the statistics. So the advantages for GPs, I'll let Amit, our GP, talk about those.
Yeah, one of the main things is the reduced administration time and administration costs as well. And also, in a way, you can look at it the other way. It's advertising GP practice as driving better standards for the practice itself. So, if conversely, that's a positive aspect for the GP practice itself. And also for us, when the patient's registered, we've got instant information that's already in our computer system, as opposed to going through the records and having to summarise, etc. So that's very, very good, especially in the first consultation. If patients are on medication that you're not entirely sure about, at least you know that the medication is already on the system. Looking at the NHS choices, the patients themselves can look at the scores, a number of GPs, whether they're female or male, what kind of languages are spoken, etc. And that as well as for the GP, it also is very, very good for the patient. As mentioned already before, it's an easier and faster registration, so not much, for the patient itself, they don't have to physically visit the surgery itself to register. You can do it all online. So notification to the patient once they're registered with the new practice, and again, it's audit trailed for any reasons for any rejection. So yeah.
Okay, so a few of the things that we've not really tried to tackle today, or other hurdles or challenges of the system. You do need to know your NHS number at the moment. We have kind of done part of the work doing integration with PDS and Spine, so you can in theory search for your details, but that would require a level of integration with Spine which is going to be difficult to get for a small app like this. For existing patients new to the country, sorry, for patients new to the country, they're probably from practice, that's right, isn't it? And
That's right, yeah, because then they will have an NHS number given to them, and it's going to be a bit more complicated to do it.
So it's a bit NHS number focused at the moment, the one we've done today. The biggest challenge is probably this third point about security identity. At the moment, when a patient registers, they go visit and typically some ID to the practice. So we have thought about various ways of overcoming that, and there's a national identity assurance project currently underway by the government to try and allow online identity to be performed. So we'll probably link into that system as a solution for that. And it is dependent upon GP System of Choice program, because it uses the currently existing national program GP to GP messages, which are basically hacking into and faking. We're kind of faking those messages there. Only GPs that are compliant with those messages would be able to work with the system. But currently, that's way over, I think, 95% of GP suppliers in the country already can use the messages that we're sending in this demo today. Okay, so the systems we've been integrating today is NHS choices for a lot of that information about the various GP practices and what they can do. The QOF data, as I mentioned before, the GP to GP messages mentioned before. We're going to be using Spine for a couple of things, specifically epidemographics, because it uses the NHS number to retrieve the demographics from Spine. It's not going to be live today, but we've got harnesses that are mimicking all that for us today. There would be integration to primary care trust systems, that's what we've done today, and emails to GPs. We haven't normally done that, and it's something we do today to simulate that. So here's a quick walkthrough. How do you have time? Because it's 10 minutes late. Yeah. So there's a quick walkthrough. On the left hand side, we've got.
Should we just stop the broadcast and then start a new one of the walkthrough? Because I'm just worried that people might want to see it. You right, Mike?
Yeah, I think so. If I hit this stop button, that'll presumably stop.